Crescentic glomerulonephritis, which is sometimes called rapidly progressive glomerulonephritis, is a type of nephritic syndrome, meaning it involves inflammation of the kidney's glomeruli. This inflammation ultimately causes a proliferation of cells in the Bowman space, which forms a crescent shape, and this change leads to renal failure relatively quickly, within weeks to months. The development of crescents in Bowman space can happen in several ways. In some cases, it's idiopathic, meaning there's no identifiable cause. When the cause is identifiable, though, it can be split into several types. Type 1 is caused by anti-glomerular basement membrane, or GBM, antibodies that target the GBM. Type 1 is associated with Goodpasture syndrome, which also involves pulmonary hemorrhages. Type 2 is immune complex mediated, meaning caused by immune complexes, composed of antigens and antibodies. This might be the case with post-streptococcal glomerulonephritis, systemic lupus erythematosus, IgA nephropathy, and Heddock-Schönlein purpura. And finally, type 3 is known as posse-immune, meaning little or no anti-GBM antibodies or immune complex deposits. In these cases, often anti-neutrophilic cytoplasmic antibodies, or ANCAs, are found in the blood, which are autoantibodies against the body's own neutrophils. Furthermore, you can break it down into the type of ANCA. C ANCA, or cytoplasmic ANCAs, are associated with Wagner granulomatosis. P ANCAs, or paranuclear ANCAs, on the other hand, are associated with microscopic polyangiitis and Churg-Strauss syndrome, the latter of which can be distinguished by having granulomatous inflammation, which is when immune cells attempt to wall off a substance perceived as foreign, asthma, and eosinophilia. Whatever the underlying cause is, the common feature is severe glomerular injury and the development of a crescent shape. Typically, as a result of cell-mediated immunity, as well as macrophage involvement, the glomerular basement membrane breaks. And this allows stuff circulating in the blood, like red blood cells, which can then go on to get into the urine, called hematuria, more inflammatory mediators, plasma proteins like complement C3b protein, and fibrin to pass through into the Bowman space. Following this flood of stuff, more monocytes and macrophages enter the Bowman space, as well as parietal epithelial cells, which proliferate. The presence of these monocytes and macrophages, plasma proteins, fibrin, and parietal epithelial cells lead to the expansion of the normally thin epithelial layer of cells into a thick, characteristic crescent moon shape. Over time, this crescent might also undergo sclerosis, or scarring, where it's replaced by connective tissue. Ultimately, the glomeruli are severely damaged, and the kidneys lose their ability to filter blood effectively, which means the glomerular filtration rate, or GFR, goes down. And if left untreated, crescentic glomerulonephritis can quickly lead to acute renal failure. On light microscopy, you'll see the characteristic moon or crescent-shaped glomeruli in all three types. The three types, though, can sometimes be differentiated on immunofluorescence. For type 1, the immunofluorescence pattern will be linear, since antibodies bind to the collagen of the glomerular basement membrane. For type 2, the immunofluorescence pattern will be granular, as a result of immune complex deposition in the subendothelium. Type 3, though, is actually negative on immunofluorescence, since remember it's posse-immune, and there usually aren't antibodies or immune complex deposits in the glomeruli, but rather type 3 is associated with ANCAs in the blood. Crescentic glomerulonephritis most often affects adults in their 50s and their 60s, and typically has a poor prognosis if not treated early. Anticoagulants might be used to reduce fibrin buildup in the formation of the crescent, and plasmapheresis is usually used in combination with immunosuppressants. If the renal failures become irreversible, they might need dialysis or a kidney transplant. Alright, as a quick recap, crescentic glomerulonephritis is a type of nephritic syndrome that's characterized by epithelial cell proliferation into a thick crescent or moon shape, which leads to hematuria, decreased glomerular filtration, and can rapidly progress to renal failure. Thanks for watching. You can help support us by donating on Patreon, subscribing to our channel, or telling your friends about us on social media.